We will also today, as I say, talk about management. The management is a set of principles relating to the function of planning, organizing, directing, and controlling, and the application of these principles to harvesting physical, financial, human, and informational resources efficiently and effectively to achieve organizational goals. During polio health program, we have three phases in the management. We have a pre-campaign management phase, we have intra-campaign management activity, and we have post-campaign management activity. In pre-campaign, we have, for example, to establish readiness, to micro-planning, to prepare team and to train them, and to carry out social activity. So we have to plan all this activity during the pre-campaign management phase. During the intra-campaign management, we have to plan about field implementation of supplementary immunization activities, supervision of team activities, monitoring, and to try to correct all challenges we are facing during the campaign. In the post-campaign, we have to plan evaluation activity. There is a critical role that play the district level. In a lot of countries, we have a local level, which is supervised by a district level, and after we have intermediary level and the upper level. So in polio activities, the district level plays a critical role. All the activity is not done by the health support from the district, and in the district we have to put together a team which involve local administrative authority, traditional authority rulers, other sectors such as NGO, religious sector, private sector, to work with partner and also other team member of the polio group. During the management or this planification time, we use some tools such as the tally sheet. Here we have an example of a tally sheet, and this sheet you have information that you have to fill. So for example, you have first to number all the houses in the community, and after numerate this house, you have to number the number of target child, and after the immunization activity, you have to fill with the number of children which are currently and normally vaccinated, and the number of children that have to be followed up. And at the bottom, you have a summary of the activity for a community, for example. This data can be also used to fill another tools. And this tool, we have to follow up the missing child in their house. So we have the name of the village, we have the number of the house, you have the name of the family, and the same data that we filled about the missed child, the planning activity, and other related to document all the information about the immunization activity. During the immunization, there is another important activity related to the supervision, but also the training of vaccinator. So during this strategy, we have to train team members about house-to-house vaccination strategy. They have to learn from previous round activities. They have to be developed in their interpersonal communication skill, how to deal with refusal, and to have what are the frequently asked questions, so they can be more prepared to carry out activity. And each day after teamwork, the team usually end their activity around 2 or 3 p.m. and they meet together to discuss, to review progress of work, challenges, success, and to plan the remaining activity. So it's important to know that this activity of evening meeting is carried out at the different level of the health system. Each level have its meeting that is nourished by others' information, so they can aggregate more information and try to address what was the challenge for the lowest level.